Hi, and welcome to your free audio training called 6 Steps to Overcoming Behavior Problems Without Burning Out. My name is Erin, and I've been involved in teaching in childcare for over 10 years. And for the last 3 years, I have worked mostly in special education settings. Throughout my experiences, my greatest challenge when working with my students was always behavior. I always had those 3 or 4 students in my class who seemed impossible to reach. They frequently got out of their seat, needed to have constant redirection, struggled to follow any of my directions, wouldn't do their work, and in some cases I had students who were violent, who refused to do anything, would run away, or even disrobed. When my journey as a teacher first began, I believed that these children would always be in trouble. But my beliefs have now changed. My beliefs have changed because I was able to work in an intensive therapeutic day school where my students experienced frequent and severe behaviors. Now, most people would think this is not a typical setting to experience success or to experience a changing mindset, but I had no choice. I had no choice but to change my mindset because I was alongside of these students who needed me. Another reason why my mindset was changed is because I was able to also work alongside of individuals including behavior therapists, counselors, and experienced teachers who helped educate me on behavior and its function and helped me understand that behavior can be improved in a very methodical way. Not only do I now believe that every child can improve his or her behaviors, but I believe that anyone can make this happen for any child, whether you are a parent, a teacher, a caregiver, or a community member. I'm sure you've encountered at least one situation or a child whose behavior was particularly challenging. And what I want you to learn from this audio training is that you can help that child improve his or her behavior using simple strategies without getting burnt out. I've met so many people who work with children or have children with behavioral needs, and they attempt to use complex systems of behavior management that overwhelm them. They don't even know where to begin. Or they don't have a system at all because they don't feel like there's a point. So you end up at the end of your rope and you think you've exhausted all methods. You don't know what to do anymore, so you just ignore the behavior. To me, this is so sad. What I want you to realize is that you don't have to ignore the behavior. You can address the behavior using simple steps that I will give you, and you don't have to get burnt out. I want you to realize that no child is hopeless. Every child can succeed, even if it's not in the way you imagined initially. And I want you to feel like you can finally breathe. So there will be 6 steps in this audio training, as well as a little introduction so you can get to know me. But before I give you your first step in this audio training, I want to let you know that this series is part of a bigger course that I'm currently creating called Beyond Behavior. Beyond Behavior addresses the concepts in this audio training at an even more in-depth level, and I mean in-depth. This is probably 1/1000th of what you would get if you were to purchase my training Beyond Behavior. Beyond Behavior also includes many other concepts that will help you improve behavior in children, whether they are your children or you are their teacher or you work with them in the community. Please don't hesitate to contact me if you're interested in hearing about this entire course after completing this audio series. Okay, let's get going with the rest of this training. So as I said, there are going to be 6 steps in this training, and I'm going to break it down to you into those steps so that you can easily understand how you can apply these strategies and how you can prevent burning out when you are dealing with children with behavioral needs. So step number 1 in this training is called Address Your Mindset. This step is the most important in this whole training. If you were to only listen to this step, you would still gain valuable information because I truly believe that this is going to transform the way that you interact with children who have behavioral needs, and really the way you interact with any child, because what you will realize is that many times your mindset is what is really preventing you from succeeding. This is because your mindset does either prevent success or it allows success in your child or your student. If you don't address your mindset and your attitude regarding behavior in children, you are also going to miss out on recognizing true success, which ultimately does lead to burning out. The biggest issue with our mindset regarding behavior is that it is often misshapen because we have expectations and desires for behavior that are unrealistic and unattainable. If the behavior doesn't go away as soon as we hope it would, or according to our timeline, we assume that we have failed and that it's a lost cause. This is just not the case. The reality is that every child's progress is going to look different, and every child won't require the same amount of time or effort. So instead of wishing behavior would go away by next week or any other predetermined time and feeling defeated when it doesn't, you should examine the specific needs and requirements of your child. Ask yourself the following questions to help you better understand what is realistic and achievable for your child. What are the behaviors that they struggle with? How often do they struggle with them? How intense are the behaviors? And how soon can you actually expect those behaviors to stop, or can you at all? Does your child have a specific disability which is characterized by behavior? If so, then that behavior may never go away completely. The reality is that when children have disabilities, many times their wiring in their brain is different than other children. And so they have an outside factor that they are working with, and you have to consider that when you're working with a child who has this need. Once you've asked yourself these questions, you can actually set realistic goals for your child with them. This process will allow you to have something tangible that you can use to evaluate a child's progress, rather than you yourself just subjectively deciding if they're improving or not. Now, it's important that you set these goals alongside of your child so that they can have accountability and be proud when they achieve their goals. Maybe you already have goals established if your child has an IEP. If that is the case, then great, you should be using those goals at home as well. But if you don't already have goals established, it's time to take the time to think about what behaviors you want to target. Also consider what tasks you want them to be able to achieve. Is there a certain behavior preventing them from accomplishing that task or activity? Then write down 2 to 3 specific goals your child can work towards achieving. If you're working with a child who has more severe behaviors or a lot of behaviors, you can start with simply 1 or 2 goals so that you don't overwhelm yourself. The method that I have used in the past for creating effective goals is called the SMART method, and many people use this within the schools. However, you can use this yourself as well, and you just remember what each of the letters stands for: specific, measurable, achievable, relevant, and timely. Most of these should be understandable, but I want to explain to you a little bit more about what each of them stands for and what that means when you're writing a goal. So you want to make sure that your goal is specific. You don't want to say something like, Joey won't be aggressive, because that's not targeting exactly what you want them to be able to do. Joey will only hit 3 times a day, or Joey will only have 3 episodes of aggression each day. And even continuing on, you want to make sure that your goal is measurable. That means, can you count it? Can you observe if it's happening or not? If you have to be subjective, then it's not measurable. It needs to be something that anyone could go and say, is this happening or not happening? It needs to be achievable. Can your child actually do this? Is it possible? It needs to be relevant. If the child is struggling with aggression, you don't want to make a goal about refusal. And then it needs to be timely. How soon do you want this goal to be achieved? Again, make sure you're not being unrealistic with your timeline. Consider the severity of the behavior when you're developing a timeline. Most of the time, goals span over the course of a year. Now, you can have smaller goals, obviously, and I would encourage that because I think it's helpful for your child and yourself to break it down. So whether you have a weekly goal, a monthly goal, or a daily goal, even all 3 would be helpful for some children who have a lot of behavior that they need to conquer. But do remember that you need to make sure your timeline is realistic. Because one of the main issues that I have seen is that having unrealistic expectations with your timeline is what often causes people to give up. They don't see success in the time that they expected to, and then they just decide that it's not worth it anymore. So I want you to understand that behavior, especially more severe behavior, will take time to improve. In some situations, you're not going to see the behavior go away, and in some you might. But it always depends on the child. So if you have your SMART goals in place, just remember that you need to look for the small victories and be encouraged by those. Don't be discouraged by any setbacks that you have either. Setbacks are always going to happen, but you can't let them convince you that your child is not having some success. And having those goals will help you remind yourself that you are having success. Another thing that I would suggest you doing to help your mindset stay in the right frame of mind is to keep a journal or a PDF form, or even just notes on your phone regarding your child's behavior each day. I know that everyone is busy, especially if you're a parent listening to this, but just do your best to write down what happens during the day with the behaviors. When you don't write those things down, you lose sight of the small victories and you aren't able to actually see what happened. When you make it a habit to record your child's behavior, you can look back on those notes and see obvious improvement or lack thereof, and then you can make adjustments as necessary, whether it be using a new resource or a strategy. Be sure to write down the specifics about the behavior. How long did each episode last? How often? And how intense was the behavior? Did it require physical restraint or just verbal redirection? Writing down these things will help you to identify common threads with the behavior and really see the success in small ways. Remember that every small success will add up to huge ones. Okay, that wraps up step number 1. Now that you've examined and addressed your mindset, you're ready to tackle that behavior head on and see success. Now that you've examined your mindset, you're ready to move on to step number 2 of this audio training. Step number 2 is called Determine the Problem Behavior and Discover its Function. Let's first start out by discussing how you can determine the problem behavior. This shouldn't be difficult for you to do. Ask yourself, what is the issue that your child is having with behavior? There are many possible behaviors that you may find yourself dealing with, and some may be more difficult or intense than others. These behaviors could include hitting, kicking, spitting, biting, punching, pinching, arguing, yelling, cursing, throwing items, destroying property, tearing pictures and decorations off of walls, turning over chairs or tables or furniture, ripping up homework or books, throwing themselves on the ground, screaming, crying, banging their head against something, running away from you, work refusal, not listening to instructions, ignoring you. There are many more behaviors that your child could be dealing with in levels of severity that are different for each child. You should be able to tell what behaviors your child demonstrates. If it is truly a problem behavior, you should also be able to notice a regular pattern. That doesn't mean that they necessarily have to happen every day, but you should be able to notice some type of pattern with the behavior if it is truly an issue. It shouldn't be something that has only happened once or twice in the child's whole life. If you still aren't sure what behaviors are worth addressing with your child, I do urge you to start keeping track of episodes during the day when those behaviors occur if you haven't already done so. This will allow you to know exactly what is going on during those times. Without identifying the right behavior, you won't be able to create effective goals that will lead towards success. After you've identified what behaviors your child demonstrates and which ones you would like to target, it is crucial that you figure out the cause of the behavior. And this is really the important part in this training because you should already have some goals established where you already identified the behavior, but this is really the important part. Identifying the cause of the behavior is really important. You cannot fix a behavior if you don't know why it's happening in the first place. Now, I need you to realize that I am not a certified behavior therapist or someone who can diagnose behavior disorders or other disabilities. And neither are you, most likely. But I have worked alongside of those individuals and I have learned that what they are teaching and what they are doing is something that you and I can do as well, just in simpler, smaller versions. You and I can still examine our child's behavior and notice some possible reasons why it may be occurring. How do I do that, you're probably thinking, or you may be thinking it seems like a lot of work or confusing, but it's really not. And when you learn the basics of examining behavior and its causes, you can truly help any child move past their behavior and see improvement. So how do we actually examine behavior? We can examine behavior using a simple ABC format. ABC stands for antecedent, behavior, and consequence. These three components are present within every behavior. And when you break it down and you find each of these components, it allows you to effectively target and reduce behaviors. So the antecedent is whatever happens before the behavior. It's the trigger. There are so many things that can trigger a behavior, and this might be evident to you already, but if you aren't sure what the trigger is or the antecedent, just pay attention to whatever happened before the behavior. After the child was calm and there seemed to be nothing wrong and the situation escalated, what happened in between? And then identify the behavior. That should be the easiest aspect of this, and then you can kind of work backwards from there. What did they do? What was their action? Were they aggressive? Were they refusing? Were they disrobing? Were they destroying property? And then once you've identified the antecedent and the behavior, identify the consequence. This can be the most difficult part in some aspects because it is sometimes something that the child is unaware of. They're not necessarily trying to do this, but it is whatever they are attempting to gain from the behavior. So every behavior has a function and a purpose. Kids don't just act out because they're being bad. They act out and they behave because they want something. They need something. So if they get that, they're going to keep doing it again and again. So try to determine what is the child gaining from the behavior. Are they escaping an activity that they don't enjoy? Are they getting attention from you? Are they gaining sensory input by banging their head against the wall or hitting somebody? Are they leaving the room and going somewhere else that they enjoy better? Are they going to a different room with a different teacher that they enjoy more? Are they getting to do an activity that they could not do if they weren't in trouble, like listening to music or watching a video to calm them down? So try to really examine what they're gaining from the behavior. If they're continuing to do it, you're giving them something from that behavior that they want. So the key is to figure out what that is that they're gaining and give that to them in a positive way. So if they are gaining attention from their behavior, you need to find a way to give them that attention. If they're gaining sensory input, we need to find a way to give them that sensory input. It's really just a methodical pattern. And when you realize that behavior is very simple to target and actually simple to correct. And that children really are just trying to gain what they need. So let's work together and try to figure out how we can actually give children what they're seeking to gain in positive ways.